Guru Prasad sir. Today is the last day of our webinar series, and the recorded version of this session will be made available on college YouTube channel. Today it's our pleasure to have Dr. Mansoor Ali sir, Professor, Government Homeopathic Medical College, Trivandrum, Kerala, as a speaker for this session. Topic of today's session is professionalism in clinical practice. Before proceeding further, I request Dr. Renuka S. Patil Madam, HOD Department of Materia Medica, to introduce Dr. Mansoor Ali sir to the participants. Over to you.
Very good afternoon to all the participants. Welcome you all, PG, UG students, interns, practitioners, and teaching faculty for the 15th day of webinar series, organized by Government Homoeopathy Medical College, Bengaluru, under the guidance of our beloved principal, Dr. V. Guru Prasad sir, in coordination with teaching faculty and PG coordination committee and PG students. Today's webinar topic is professionalism in clinical practice. Dr. Mansoor Ali sir is the speaker of the today's session. I, Dr. Renuka S. Patil, Professor Ghmch Bangalore, take the privilege to welcome you, sir, for the today's session. And let me introduce Dr. Mansoor Ali sir. Dr. Mansoor Ali sir is from Calicut, Kerala, and he is a professor from the Government Homoeopathy Medical College, Kozhikode, Kerala. And he is approved practitioner for Ministry of Health, United Arab Emirates. And he is also a member, Board of Studies, Homeopathy, UZ. And he is also a member for the Board of Studies, Homeopathy, PG faculty also. A PG and PhD guide also for the Kerala University of Health Sciences. And he is also in editorial committee, Health Sciences, the peer-reviewed journal of Kerala University of Health Sciences. And he is a recipient of Best Teacher Award in 2019 by Kerala University of Health Sciences. Dr. Mansoor Ali sir took up his BHMS and MD courses from Government Homoeopathy Medical College, Calicut, and joined in the same institution as a teaching faculty in 2006. And his website, homebook.com, provides the largest collection of the teaching learning materials for medical professionals and provides the highest number of placements in the Ayush system. And he also presented papers in several states, national and international conferences, and around about 60 papers published in reputed homeopathic journals in India and even in abroad also. And he is also an approved practitioner, Ministry for Health, United Arab Emirates, and he conducted various workshops and training programs for PHMS students, interns, and government medical officers also, and even for the teachers and practitioners across the India. He is also visiting lecturer, examiner, and question paper setter to many homeopathic institutions and universities also. He's also a regular speaker in All India Radio, handling the topic Arogyam Amulyam. And he's also the PG and PhD guide to Kerala University. And he is honored with the National Award Homeo Sri in 2011 for the contribution to homeopathic education through web-based learning and teaching. So now I'll call upon you on the screen to present your topic. Thank you.
Thank you, ma'am, for the nice words. Respected principal, teachers, and the postgraduate students of the scholars of the Government Homeopathy Medical College, Bengaluru. I would like to thank the entire team for inviting me to share some ideas with you. Today we will discuss something innovative and something interesting. How to develop an online consultation platform to grow your clinical practice. That's the need of the hour, especially since last 1.5 years. So this presentation will give you step-by-step approach on how to develop a clinical practice online, how to treat the patients across the globe, and what are its benefits, its demerits, etc., in detail. So this is a precise presentation that will help definitely the postgraduate scholars and also the practitioners to learn something about the how to become an intercontinental or an international practitioner in homeopathy. Now some background. More than 1 crore of Indian population consulted the homeopathic doctors online the last few years. But remember, the population of India is 1.25 billion. So far, we have covered only 1 crore of Indian population. So that's a good scope. And online homeopathic connectivity worldwide is more than 100 plus countries. That means you can treat patients across the globe by simply sitting at home. So that is what we are going to discuss now. How to become an international or an intercontinental or an online practitioner in homeopathy. The new generation doctors like you realized that it is not possible to survive with the limited number of patients from our local area. So that's a custom, that was a custom earlier days, to start a clinic in a local or in a rural or urban area, and depending upon the patients on that particular area only. So that is nowadays very difficult because a lot of doctors are there from different systems of medicine. So it is very difficult to survive with the limited number of patients from in and around our clinic area. So we need to come up with innovative and newer ways of reaching out patients directly. So the new generation doctors like you, the energetic people like you, realize the situation. So this is something about the FedEx. That means you can treat the patients across the continent, intercontinental practitioner in homeopathy. One beautiful advertisement by the FedEx courier system. Like this, you can treat. I will explain in simple steps how we can develop an online platform. The telemedicine market in India is currently 1 billion US dollar. That means around 7,000 crore. So that's the current market in India, 7,000 crore. To reach the 5.4 billion US dollar, that about 40 crore, the expected outcome, that is in 2025. That means 5.5 times growth of the telemedicine market in India. So you can become a millionaire or a billionaire within years. So the expected outcome by 2025, that is a 40,000 crore of Indian rupee. That's the expected telemedicine market in India. So you can see the growth by 2025. They're expecting 5.4 billion US dollar. Now, what about the global telemedicine market? That is currently near 42 billion US dollar. That about 3 lakh crore. Remember, the 3 lakh crore, that is not a simple number. So that's the current market of telemedicine market across the globe. To reach almost about 400 billion in 2027, they are expecting the growth in 2027. That means 10 times growth from the current level in next 7 years. So without it, it's very difficult to survive nowadays. So from 3 lakh crore to 400 billion in 2027, that means 10 times growth. That is they are expecting in the telemedicine market. So my dear friends, utilize this opportunity. It's a very big opportunity, the telemedicine or online consultation. And this is a body under the government of India that is a telemedicine society of India. You can join with this fellows also. The annual, the membership fee is around 5,300. It's actually located in Lucknow with the state branches across India. Even in Kerala, in Tamil Nadu, Karnataka, they have branches. So if you are joining with the Telemedicine Society of India, that adds some reputation to your prescription that you can send the medicines across the globe also, if you are a part of Telemedicine Society of India. And remember, this is not compulsory, but they are coordinating everything. They are also giving the training to the doctors also. Now, what is meant by an online treatment? It is simple. To avail the treatment through the internet without having to visit the doctor's clinic personally. The patient, without having to visit the doctor's clinic personally. And the communication between the doctor and the patient is completed through the various medias like email, telephone, chat, and video conferences. Everything nowadays is easy. You can have the telephones, email, or the chat or video conferencing. Now, what are the features of the online consultation? That breaks the time, space, and language barrier. That breaks the time, space, and language barrier. Patient from any corner of the world can avail online treatment facility. And there is no time constraint. You can complete the case record at the time of convenient time to you. In our day-to-day clinical practice, if we are practicing in a rural or urban area, we must have some fixed consultation time. But there is no time constraints for this online consultation. You can complete the case record at your own time or the convenient time for you. And there is no space. There is no space required for that. That means a clinic or some pharmacy or something like that. Even while sitting at home with a good internet connection, you can treat patients across the globe. And there is no language barrier because a lot of applications are there now that can translate from any language into the English or even into your regional language. So the patient from any corner of the world can avail online treatment facility. So just relax and earn. Just relax at your clinic or at your home and earn patients from across the globe. And why online consultation? Some background. 72% of internet users say that they looked online for health information within the past year. Remember, 72% of the internet users, they searched the health information online. And 52% of the smartphone owners have used their phone to look up health or medical information. 52% of smartphone owners. And 46% of the people go online for diagnosis of their illness or medical condition. Now, there are a lot of reputed websites are there. You just feed the symptoms of your patient, or even the patients or the layman can feed the symptoms. That websites will give you the diagnosis. So 46% of the people go online for diagnosis. And remember, the 10 million searches are taking place every month on Google to look for a medical professional like you. Remember, that's a very big figure. 10 million searches every month on Google to look for some doctors. So if you have an online presence, you will definitely get good practice. So this is a background. And some interesting story also from the Jeff Bezos, the founder of Amazon. Their turnover is $380 billion. He read about the report on the internet growth in a magazine during his railway journey and expected that 230% per year. Now their turnover is $380 billion. Just sitting, just giving a platform to connect between the customers and also the manufacturers or the distributors. They are earning $380 billion. So you can utilize the different mediums like the internet and the YouTube. We will explain in detail about each and every one. The Google Map, how you can utilize the Google Map for a practice. How you can utilize the social media like the Facebook, Twitter, etc. And what is the need of that? And a personal website. What are the main contents of the personal website? And the online consultation module and the local listing in Google. We'll discuss one by one. So you can have the free listing available in different websites. Remember, by simply designing a website is not sufficient for online practice. You have to give your profile in this type of website. The quicker.com, the OLX, the quickkerala.com, Google AdWords, Google Local, LinkedIn, JustDial, Practo, IndiaMart, and the Doctors Directory India.com, medindia.net, drdata.in, dralia.in, Librate, Indian Medical Sites.in, IndianHeartbeat.com, MyDocZone, adwords.google.co.in, and adwords.google.co.com. So free listing is available in this type of website. Hundreds of websites are there, but these are some major websites. You have to list your profile in this type of. Otherwise, your online presence is not sufficient. Now, one good example is from homeopathy sector also. And the Dr. Rajesh Shah from Mumbai is a role model in this field. And according to him, he treated from patients 180 plus countries at live port. So just visit this website, askdrshah.com. You will get some good idea about that. Askdrshah.com. It's a wonderful website. And another wonderful example from Jawar Shah, the homeopathy team, Welcome Cure. They are managed, they have 100 plus global panel of expert homeopathy doctors. You can also join with them. They'll give you the revenue. I am a repertory expert in this Welcome Cure. So their website is welcomecure.com. And dear post PG scholars, just note on these websites. And when time permits, you can visit this website and you can realize how wonderfully, how beautifully these people are doing online consultation and how to design a website. You can join with the Welcome Cure Jawar Shah team also. They will definitely give you good revenue per month. Since I am also a part of this Welcome Cure as a repertory expert. Then the HomePod, they have designed a good mobile application that's available at affordable price too. That the mobile application is homeopathyapps.homepod.com. So that's a mobile application. That means you can treat patients across the globe. So another good website is connecttomydoctor.com. Connecttomydoctor.com. They are also offering free listing to homeopathic doctors and connecting the patients and the doctors also. And the recent platforms like the mydogzone.com, curofy.com, hogvagy.com. These are some wonderful websites. They are internationally reputed websites that covering the not only the homeopathic doctors but the allopathic doctors, the dentists, etc., etc. So list your profile in these websites. That is free also. And select some specialties like the allergy, infertility, rheumatology, whatever it may be. If you are selecting some specialties, you will get more patients. If you are listing in this type of diseases, not merely as a general practitioner. So these are some wonderful websites. You must list your clinic or your profile. Even I think if the postgraduate scholars are not permitted to do their private practice in a location, I mean in a clinic, but you can have the online consultation if your college permits. So according to the Welcome Cure, they are treated 1 million patients in over 36 countries. And they will provide you website and also the electronic medical record facility also. They have the global clinic and patient management tools. And they will deliver the medicine also. Since you suppose if you have no pharmacy, so you are a postgraduate scholar simply sitting in your hostel or at your residence, you can practice. You can join with them. They will send the medicine, no need of any pharmacy. Their packing, the transport across the globe is wonderful. And they will give you a payment gateway also. If you are joining with them, they will give you a payment gateway. And so that you can receive the payment from across the globe in dollars or in euro. And they are also providing the marketing support. Marketing is actually it's actually needed in our profession nowadays, not like olden days. Simply the mouth-to-mouth publicity, that is not sufficient. We need to market our practice. If you have some substance, that should be not the other people without. It is very difficult without marketing. So don't worry about setting up a pharmacy. If you are joined with the Welcome QR team, they will send the medicines across the globe, but you can receive the payment also. So their practice means their website is Doc Solution. If you are visiting the Welcome QR website, you can see an option, become an affiliate. Become an affiliate. Around 10,000 rupees you have to pay yearly, but that is a comparatively a little amount. They will provide you the website, good website, the marketing side. They will provide you the medicine, everything. So that's a good option, especially for the new generation doctors like the postgraduate scholars. So what are the main contents for a doctor's websites? You can create a website from 5,000 rupees up to 1 lakh. The minimum and average minimum for a simple website is you have to pay for 5,000. That means 5,000 for the entire life if you are not updating it. Or you can have up to 1 lakh rupees because some websites that may need some more script and other things. So the main contents of a doctor's website, even you can create your own website. The Google is providing the facility for that. So that must need the detailed information about the doctor, the qualification and the license. That is compulsory. Your state registration number or your qualification, that should be listed in the homepage itself. And the facilities offered in your clinic. What type of disease you are concentrating? Remember, in an online consultation, not like a general practitioner, you have to select some areas like of your interest. Suppose I used to select the cosmetology treatment and also the rheumatology treatment like the SLA and RA, etc. That we can do wonders with the homeopathy comparing to modern system of medicine. So the facilities offered in your clinic. Never select a lot of diseases, but only few diseases. And you have to mention the consultation time also. If you have an offline consultation also. Online consultation now comes time constraints, but for an offline consultation, you must means you have to mention the consultation time. Suppose your clinic time is 4 to 8 p.m. that you have to mention in the website, and the booking phone and the time also. That is also very compulsory. We must have some specific time for booking. Otherwise, the patient may used to call at all time. Even after midnight, they used to call for a booking. So you have to mention at the time of booking, whether it is from 8 a.m. to 12 noon, like that. And the contact information of the doctor and the Google map also. So that is these are the main contents. You can see my website. Just I will show you. Suppose if you are clicking on the drmansoorali.com, it's a simple website. So on the top itself, you can see the time, our consultation time, whether it is 4 p.m. to 7 p.m. or our phone number, and some slides are also there, and what we treat and why homeopathy, about Dr. Mansoor, like that. Some simple informations. And also see on the right bottom, the Google map. If the patient is clicking on the Google map, that will give you the exact route to your clinic and the contact information and some quick links like that. So this is a simple website. My website is drmansoorali.com. So see, one of my friend, Dr. Prashanthi, they are treating the patients across the globe. This is listed in your, that means the smile beyond the boundaries. So this is the contact page, the address, phone number, email address, and see on the right side, you have to mention this also, distance from the airport, distance from the railway, and distance from the city, like that. You have to mention it so that the patients will get a good idea about how to reach your clinic. Okay. Now, see, one good case record form is also required in your website. If you are designing your website with the local team, or if you are designing the website in your own, a good case record form is compulsory. But remember that never put our entire classical case record. It is very difficult to fill the entire classical case record. So I will give you a simple case record form just to see this. So this is a case record form mentioned in the recwig.com. Recwig.com. See the area. That means the name, age, height, weight, phone number, email, then occupation. Then the next column, details about your present disease or ailments in order of appearance with the duration. That means the presenting complaint and history of presenting complaint in a single slide. You can type here, fever or whatever, like whatever may be like that. And if you already seen a doctor, what diagnosis did they give? That's the second column. And the third column about the investigation. And if there anything you have to, means any other relevant problems, that's the fourth column. Then about the past history. Then the physical generals like the appetite, thirst, urine, stool, perspiration, sleep, etc., etc. And for the females, there is a section, the gynecological and obstetric history, the menstrual history, and about the family history, and about your personal habits like the cigarette smoking, alcohol, etc., etc. And that is followed by the payment option, a payment gateway, where you can mention your Google Pay or the net banking or the debit card or a credit card or Paytm, whatever it may be. So this type of simple case record that is required. Remember, never put our classical case record like the PC, HPC, past history, family like that. So give only a simple case record. And if you need, you can email them for further clarification. Otherwise, if you are putting a lot of columns, it is very difficult for the patient to fill because the layman is not at all aware about the nature of the homeopathic case record. So collect the main features. Then if you want, you can write to them. So there's a good case record form that is a sample case record form that is available at the rekivicindia.com. And you must have some good Google reviews also. You have to tell your patients about your treatment, just mention in Google reviews. So if suppose if you are just clicking on this my Google reviews, so this type of Google reviews will give you a top position if a patient is searching on the internet. See, they are giving about the details about my clinic. On the right side, you can have the reviews also, the exact location of my clinic. So if you have this type of good reviews, your name will be listed on the top if a patient is searching about a particular doctor. So these are some means reviews given by my patient. Dr. Mansoor Ali is an excellent doctor, like that. So if you are searching for a doctor, suppose for a homeopathy doctor in your area, your name will be listed on the top if you have some good Google reviews. So that the patients will definitely help you, especially as educated people. So remember, a good case record form and good Google review that will give you on the top position if a patient is searching for a doctor in your area. And the local listing, that is very, very important. The general Google listing followed by local listing, that I will explain to you. When a consumer conduct a local search on their mobile device, according to the sources, 50% of them visit the store within a day. Suppose if a patient searching in the internet for a homeopathic doctor in your area, more than 50% of the patients will visit that doctor within a day. So that means people are searching for local physicians and doctors and visit them immediately. So in addition to the general listing in Google, we must have the Google local listing also, that I will explain. Suppose this is a search from Calicut, homeopathy doctor search from government homeopathy college, government homeopathy medical college, Calicut. You can see my name, my college, my house is my clinic situated 11 kilometers away from the college. But that is listed on the top. Homeopathic doctor in Calicut, if you are giving a search like that. My name is listed on the top, Dr. Mansoor Ali homeopathy treatment. Even though my teachers, they are practicing nearby to the college. Their name is lost. Their name is not seeing in the Google. So that's a need of listing in Google. Google local business. That's a website for adding your profile. Suppose see, just if a patient is searching like giving the keyword like the homeopathic doctor, you can see the main doctors on the right side. Their websites are listed. Their means the Google map is listed on the right side and their name on the left side. So without the local listing in Google, that means the Google, you have to visit the Google local business. That's a website from the Google. So you have to list your clinic, your consultation time, everything. Suppose if a patient is searching from your local area, then only your name will be listed. In the past, the patients or they used to means they visit the nearby shops or nearby home in order to find out a doctor, homeopathy doctor, who is a good doctor in this area. Now they can find out from the Google itself with good reviews, a doctor with good reviews, a listing in the Google local business. Nowadays, everybody have their own mobile phone. They will simply search. They are not going to ask the nearest shop or nearest house, can I get a homeopathy doctor nearby? Is there any homeopathy doctor nearby? And who is a good homeopathy doctor? They simply search in their mobile phone. So if your clinic is not listed in Google local business, and also there are a lot of websites that we already mentioned, they will not find your clinic. Okay, so that's the need of listing in Google. So not to limit your career to the local market, spread nationally and internationally. Dear postgraduate scholars, spread nationally and internationally. It is very difficult to survive with the limited number of patients in your clinic area. We can treat the patients across the globe. Now the packing and postage. We have to send the medicines to the nearby state or nearby country or from remote countries, etc. You can send medicines to across the globe. And there might have some difficulties for sending the medicine to US and Canada. Sometimes the customs people, they want the drug controller certificate from the drug controller. Currently in homeopathy, we have no drug controller, only the allopathy people. Sometimes they will not give that. In certain situations, the DHL or the Blue Dart people or Aramex people, they are not accept the package. If you are sending medicines to US and Canada and all other countries, it is very easy to send. It is very easy to send medicines. So the materials required for the packing and postage for outside country. In India, this prescription or the declaration, everything is not needed. So if you are sending the medicines, a clear-cut prescription is needed. That should mention about the name of the patient, about the age of the patient, the main complaint, followed by the medicine and the content of the medicine, and also you have to give the bill also. That means you can write in your prescription pad, collect rupees 5,000, the amount of the medicine, that is 5,000. If you are now printed bills, especially the people working in the government sector or people working in the government dispensary, they can't give bill, but they can write it in your own handwriting about the amount also. So a prescription is required and also the bill of the purchase of medicine that you can give or you can collect from the nearby homeopathic shop. Then followed by a declaration. If you are sending medicine through the India Post, the post office people itself will give you a declaration form. 2 copies of the declaration form that you have to sign it. And if you are sending medicine through the Aramex or the Blue Dart or the DHL, they will give you a declaration form. I will give you the format of the declaration form. So you have to fill that declaration form. That's nothing about, I will give you this, the details about that declaration. So this is a declaration form of the DHL. That means the name of the medicine and what type of disease you are prescribing for the thyroid or whatever it may be, and the prescription, that is yes or no, yes, and the daily dosage, unit value, and the manufacturer's name also, that you have to mention. Even though you are giving the loose package, you can mention it as SBL or Wilmer Shop, etc., etc. So this is a format for from the private courier service. For the post office, they will hand over a symbol form in 2 copies that you have to sign it. So a declaration form. So you can opt either India Post or courier service also. And I am recommending India Post because they have door-to-door delivery across India. If you are sending the medicines through the private people like the this First Flight or the professional courier, etc., the patient need to collect the medicine from their shop. They have no door delivery. They have delivery only to the shops. If you are giving an address of a shop, that's okay. Otherwise, if you are giving a residential address, they will not supply the medicine. The elderly people, suppose only 1 or 2 maybe there in their house, they have to travel a long distance to the courier company and collect the medicine. So never send medicine into a home address through a private courier companies. You can send to the Blue Dart also, they have the door delivery, but for other companies they have no door delivery. But the India Post is comparatively very cheap also, and they have door to delivery also. And the medicine, remember, the prescription for the medicine from the narcotics like the opium, naja, laxative should not write a prescription. They will mistake, they will confuse it as they will think that the package contain opium, or the package may contain the poison from the naja or the laxative, something like that. We know that the medicine content is not there in laxative 1 or opium 1, but it is very difficult to convince the customs people. So even though you are sending medicines like the opium, naja, laxative, etc., etc., never write the prescription. You can write some other name, some vegetable remedies like the bryonia or the rustos, etc., etc. So remember that if you are writing a prescription like laxative or opiates, the medicine will return from the customs. So never give a prescription based on the narcotics, even though you are giving. And the liquids are not allowed by the many of the courier companies or the India Post. But some private companies, they are allowing it. But in majority of the instances, it is not at all advisable to send mother tinges, because that may spoil other packages also. That is the reason they are not accepting the liquids. You can send in powder form, or you can send in tablet form, or in globule form. So these are all the main thing. Means you have to pack your medicines followed by bubble sheet that's seen on the right side, and a detailed prescription is required, and the bubble sheet. These are all not at all. This declaration is not at all required for sending in medicine inside India. No need of any prescription also, but you have to pack it thoroughly with the bubble paper. Otherwise, that may spoil of the tablet or the globules. That may be in a powder form on reaching the patient. So you have to pack it thoroughly with using as much as Google means bubble paper as possible. And remember, in India and outside also, the liquids are not allowed as per their norms. So you have to mention it as for personal use, the name, date, the complaint, the sign and seal, and also the receipt also. Okay. So the generic name, these are some explanation given by the DHL people about the daily dosage value, etc., etc. But if you that's something interesting, that if you are paying more, the medicine will reach fast. Suppose if you are sending a medicine to Australia through DHL, that will reach around between 4 to 5 days. But if you are sending the medicine through the India Post to Australia, that will take around 3 weeks. That's the difference. But the amount you have to pay for sending a medicine of 1 month to Australia, that is nearly around 500 rupees. But for the DHL people or the Blue Dart people or Aramex people, they will deliver within 4 days, but you have to pay nearly 4,500 rupees. That's the difference. They will deliver faster, but the rate is so high. If the patient wants the medicine immediately, you can collect this parcel charge or the delivery charges also from the patient. You can add it. You can ask the patients whether you need medicine 3 or 4 days or within 1 week. And that depend upon the need of the patient, and you have to collect that additional amount from the patient. Even for the UK, the India Post people is charging only 200 rupees for sending medicine for 1 month or 2 months. That will reach within 4 to 5 days in UK. So India Post, they deliver across the globe also. Now, something interesting about the internet users in India and other countries. India bypassed Japan to become the world's third largest internet user after China and the US. Remember, you are consulting online by simply sitting at your home. Then the current internet users in India, that about 480 million, and the share of India population, that is 34.8% penetration. And the internet users across the globe, that is 4.57 billion. So India bypassed Japan. So after that, only China and US. Then India, we have 1.2 billion mobile users, the second largest in the world. 500 million smartphone users, 90 billion of the smartphone users by 2022. Remember, 890 million, and 7.5 lakh public Wi-Fi spots also. And the Bharat Net phase aims 100% connectivity by 2020, and that is not achieved because of the COVID. And Kerala is the first complete digital state in India with the mobile penetration 115%. And across India, that is only 91%. But in Kerala, the mobile penetration is 115%. And they declared the internet as a fundamental right of people by 5,000 Wi-Fi spots across the state by 5 years. And that also not achieved years. Now, my question, the doctors changed. The truth is that the society has changed. I will give you some good example how the society changed or adapted the technology. But the doctors have failed to keep up with the times. We need to come up with innovative and newer ways of reaching out the patients directly. So doctors changed or the society changed, that we can understand. Remember the 10 years back, there were a lot of public call offices everywhere, as seen on the left side. STD, ISD, public call, and the mobile phone came. What happened to this PCO? Everything disappeared. But now the third store in the market is a mobile shop. They changed, adapted the technology. Every third store in the market is a mobile phone shop. Now they are not only doing this call facility, but the sales, service, recharge, accessories, repair, maintenance, and upgradation. So the society changed. And one good lesson from the Paytm. Mr. Vijay Shekhar of the Paytm changed the entire financial structure of India through a smartphone payment system, that's the Paytm. Within 3 months of the demonetization, a terrible thing, the demonetization, in March 2017, their customers become 18.5 crore with 80 lakh daily transaction, 200 crore of INR deposited daily invalid. Remember, within 3 months of demonetization, they utilized the opportunity. They utilized the opportunity of this payment system. Their business in January 2017, that's about 500 crore. And within how they achieved it, within 2 days of the announcement of the demonetization, representatives visited every nook and corner of the country and trained the common man and shopkeepers on the digital payment system. Within 2 days, remember, utilized an opportunity. Now 300 million registered users. They have 300 million registered users. That's the first digital payment system in India. After that, the Google Pay, WhatsApp, a lot of other systems came. Now, something interesting about the Facebook, the most preferred social media network. Their turnover is 27.64 billion. Remember, their turnover is 27.64 billion last year. But remember, there are no content of their own. They are not publishing. The Zuckerberg is not publishing anything, but they are giving a medium to publish or discuss. With that, they are earning $27.64 billion. And remember, the Uber, the largest transportation company, in 633 cities and operating in 72 countries. Only 8 years in the field. Their turnover is 37 billion US dollar. But remember, they are not owned a single taxi. They are simply connecting the customer and the taxi drivers through a medium of internet, a mobile app, utilizing the medium of internet. They have no single taxi, but they earned $37 billion, $37 billion yearly. That's their turnover. And remember the Alibaba.com, the largest retailer in the world, but they are not stocking anything, simply connecting the customers and the manufacturers or the suppliers. They earned crores of rupees. The largest retailer in the world. They are not stocking anything. And the Airbnb, the largest e-lodging provider. Suppose if you want to visit a country or another state or any country across the globe, just log into Airbnb website, they will provide the lodge. But remember, they have not owned a single lodge. But their turnover is 93 billion US dollar. They have no lodge, but they are the largest e-lodging provider. But remember the Hyatt Group, like the Taj Group, the Hyatt Group, they have the largest number of hotels across the globe. But their turnover is only $4.69 billion. Only 4.6. Even though they have the largest number of hotels across the globe. But Airbnb people, they have developed a website or a mobile application. They are earning 93 billion. So that is the beauty of the digital area or the internet. So Facebook have only one main office, only 150 employees in 2006. At that time, their turnover and Uber, they are not purchased a single car, but earned 37 billion through a digital platform. And something about the Delta airline. They have 1,100 aircraft, 40,000 services. Their turnover is only 4,000 crore of US dollar. And something interesting about the YouTube also. Google purchased YouTube for 1.65 billion US dollar. But now the revenue at the last year is 4.43 billion. Google earned this much from the YouTube channel. So see the top 10 largest companies by market capitalization. After the Microsoft and Apple, see the Amazon. They are not storing anything. They are just connecting the customers and the shopkeepers or the manufacturers. And see on the 5th, Facebook. On the 8th, that's Alibaba.com. They are not stored anything. So that's the beauty of the digital platform. So there are many examples like the Paytm, Ola Cabs, or the Oyo Rooms, etc. They are using simply a medium of internet by mobile applications or the website. And this type of Paytm accepted here or Google Pay accepted here, like that UPI or accepted here, like that. That's compulsory in your clinic also. That is easily available without paying anything. So ready to change, prepare to change over a time, and run with time and get success. If you are not updating, you will become outdated. If you are not updating, you will become outdated. Prepare to change over time. And something interesting about the YouTube. YouTube now has over 2 billion users every month. 2 billion users. A distance from Facebook of 2.6 billion. And YouTube, Google's most popular service with even more users than Gmail. YouTube has more users than Gmail. And remember on the last paragraph, video on social media generates 1,200% of more shares than text and images combined. So upload the video about your clinic, about your type of treatment, the infertility, or whatever it may be in YouTube. That will generate 1,200 more shares than sharing a text or an image in the social media or in the YouTube or in the internet. So that's that type of that much of visitors are there for YouTube. So create a simple video about your clinic or about your specialty and upload in the YouTube and then give that link to this different social medias or WhatsApp group that have 1,200% more share than sharing text or images combined. Okay. Now India, now a mobile first market. Smartphone is the new global addiction. Government start BharatNet phase. And why should a physician engage in social media? Why and how we can engage systematically or tactically in a social media? That is what we are going to discuss. And the research has shown that an online referral carries more weight than any other form of marketing. Social media for doctors allows an interaction with the patient position themselves as an expert in their specialty. Suppose somebody asking about a question about the coronavirus in a WhatsApp group, in a local WhatsApp group or family group or a WhatsApp group in your city, like that. You can give some specific, some good opinion about that. An opinion about an epidemic disease or an epidemic about recent some type of disease in your locality. So that adds some reputation. That allows an interaction with the patient and position themselves as an expert in their specialty. And social media also affects search ranking also. If you have good social media like the LinkedIn or the Facebook or or this other platform, other social media platforms, your Google ranking or your internet ranking, that also affects. That means you will get a good rank. So healthcare professionals trust the social media. That is another one. About 60% of the people say that they trust the social media posts written by doctors. If you are writing something about the homeopathic management of COVID in an internet, in a regional language, that is more better than writing in English. In order to get more number of patients, local patients, you have to write it in a regional language, or otherwise you can have in English also. So more than 60% of the people say that they trust social media posts written by doctors. See, one of some of our posts, Dr. Mansoor, your friend have liked your post 84,000 times. And we have good reach in social media also. See some of our posts, 552 comments, or see on the bottom, right the bottom, 4,400 shares. Some of our posts were shared by this much of shares, 4,000 400 shares, and 2600k likes also. So that is the power of social media. That will reach more number of patients than we imagined. Then we are giving an advertisement in a local media, advertisement in a newspaper. That's more, this type of interaction in social media is more better than giving advertisement in a newspaper or a local journal. Now lastly, something about the hair hostess philosophy. So what is mean by a hair hostess philosophy? You have to implement this philosophy in your clinic, an offline clinic, not about the online clinic. See on the right and left, both of them are doing this more or less same job. They are hostess, they are serving the food, they are cleaning, they are asking something about what you want like that. Our homemade also asking the same one. The housemaid also asking the same thing. They are cleaning, they are preparing food, but see, the social status is entirely different, the salary is entirely different, and the celebrity position, that is entirely different. Everybody is looking towards a hair hostess. They are the main attraction in a flight also. Everybody is looking on. They are in a celebrity position. Their salary is too high. They are simply serving the food. Housemaid also serving the food or cleaning the house. But see the social reputation, the salary, the celebrity position. So if you are designing a offline clinic in your local area or in your city, you have to follow the hair hostess philosophy. So design impress the patients about the quality of treatment offered. And this is the lobby of the Patras. The lobby is made of stress-free and comfortable for the visitor with a TV set, music system, or the lighting, etc. I will give some good chambers designed by our own doctors, homeopathic doctors. Some good chambers. Reception. These are some doctors in and around Kerala. See the toy in front of the doctor. That will give some soothing effect to the crying baby or the crying child. These are my students also. That should look elegant, elegancy. Hair hostess philosophy. Some good looking clinics. That needs some investment, but you will get more return if you are designing like this. And also the people around your clinic, they are also impressed by your presence or impressed by your clinic. And the parents, they are coming for the treatment for their children. They are also impressed by homeopathy. If you are designing a good clinic, that will give a good impression to the parents also. Parents, they are coming to the clinic because they also send their children for homeopathy, as a homeopathy for homeopathy courses also. By simply seeing your social status or your clinic, the common people, they will send their children also for the homeopathy courses. Never design a clinic like this. Doctor should not sit in front of some medicines. Avoid this type of design. See, on the stool provided on the right side of the patient. You have to provide only the stool. Never provide a chair for the patient. You can provide that for a bystander. Otherwise, it is very difficult to examine the patient. So hair hostess philosophy in designing of the clinic. You can opt in the service of an interior designer also. They have more idea than us. They will utilize the minimum space for the maximum purpose. And always remember, take rest and time management. We lost a lot of doctors nowadays because of the COVID and other thing. Remember, your job won't take care of you when you are sick. Only your friends and family. So always keep in touch with your friends and family. Never indulge the full time in your job only, because your job won't take care of you when you are sick. The patient or the administrators or the institution head, they will not take care of you when you are sick. Only your friends and relatives like the father, mother, wife, or husband. So take a home message, a homeopathy clinic with the right ambience, tools and equipments, responsive staff, and an online presence goes a long way in offering a high quality service to the public. So the online presence is not always needed for getting patients offline also. That will attract more patients to your clinic. So that I already mentioned, if suppose a patient is searching in the Google for a local doctor, if your name is not listed in Google local business, it is very difficult to find out your clinic. So once a patient visits your clinic, make sure that you create a lasting relationship through your service and communication. A satisfied patient is a brand ambassador for promoting your service. So above all and most important, the treatment, the quality of the treatment. Money, fame, publicity, etc. will follow automatically once you achieve your mission of curing the patient. Remember the quality of treatment that is more required than the publicity or marketing. So money, fame, publicity, etc. Everything will follow automatically once you achieve your mission of curing the patients. And we used to get the patients from other system of medicine. More than 60% of the patients are from other system of medicine. So if you can cure the patient, that will add money, fame, and publicity. Stethoscope and apron. It is the most expensive jewelry and clothes, for it costs you your use. So never think desperate or fed up. Whenever you feel bad, just remember that Coca-Cola only sold 25 bottles in the first year. Never give up. At least 2 to 3 years, you have to sit up in a particular clinic. Then you will get patients. And majority of the newcomers have a bad habit of sitting in a clinic for 6 months only or 1 year. Then they will discard that patient, saying that no patients are there. But you have to sit at least 2 to 3 years in a particular locality. Then you will get patients. Otherwise, you will never get patients. You have to sit for the patients the proper time. Suppose if your clinic time is 4 to 8 p.m., you must be there. Otherwise, the patient will not queue for you. They will not sit in your clinic. And remember, in online consultation also, at least 2 to 3 years of continuous presence in the online. The internet is required to get large number of patients. In the initial, you will get only limited number of patients. But if you spend some time on marketing in your internet by different websites in Google, Yahoo, and a lot of websites we already discussed, you will definitely get more number of patients. And the size of your audience doesn't matter. Keep up the good work. The size of your audience doesn't matter, especially in the beginning time. We'll get only a limited number of patients, but keep up the good work, you will get more number of patients. So your success is important to us. So best wishes. So once again, I would like to thank the principal, the entire teaching faculty, and the postgraduate scholars for inviting me to share some ideas, some innovative ideas that we already implemented successfully, implemented by many doctors across India. And the new generation, like the doctors, like the PG scholars, they also can easily implement it, this type of things. And that's all for the time. You can contact me at similima@yahoo.com. That is my email ID, or my website that I think you are familiar with, homeobook.com. And the personal website is drmansoorali.com. We are always ready to support you. You can contact by email or WhatsApp number. My WhatsApp number is 9249337799. And that's all for the time being. Thank you for your patient hearing.
Well, good evening to all the viewers of today's webinar done by Dr. Mansoor Ali sir. And the session also has come to an end. Hope every one of you have perceived this topic today, and you will have to follow in your practice how beneficial and interesting, how good the consultation made easy for all the homeopaths. And sir is also very good enough to highlight and aware of the practice, that how to develop an online consultation platform to grow your practice, online medical practice for the new generation doctors with limited people, knowledge about buy online, using mobile app, welcome QOT, website, EMR, global clinic, patient management tools, delivery of medicine, payment gateway, marketing support, telemedicine platform for doctors, package and postage, materials required, personal medication, internet user India and other countries. All this is very, very beneficial and useful to all the practitioners. Hope you have perceived and you are beneficial today, right? And as sir said, see here the version, sir, Dr. Mansoor sir, we also agree and accept your version. If you are not updating, you will become outdated. Yes, we do agree. Sincerely, we are asking all the viewers to follow your verse, because it's very difficult to get one and make aware of everybody about the practice. Yes, sir, I thank Dr. Mansoor Ali Khan, sir, Ali, sir, once again for having given your valuable information about professionalism in clinical practice. Thank you for your presentation, sir. Because it's an end of the webinar, I also would like to thank all the speakers from first day till today. For the past 15 days, the organization of GHMC is continuously going and successful. Yes, we do thank on behalf of principal and the coordination committee. I do thank Dr. Ashok Kumar Dantakale, sir, Dr. Muhammad Jamil Said, Dr. Ambrish Vijayekar, Dr. Sri Arsha, Dr. Adil Shimantwala, Dr. Madan sir, Dr. Akil, Dr. Chirant, Dr. H.L. Swami, Dr. Nishant Gandhi, Dr. Manohar, Dr. Munawar Sheikh, Dr. Aril Wanan, Dr. Vijay Krishna, and Dr. Mansoor Ali Khan sir. Right, here I would like to once again on behalf of everybody, I also thank to all the practitioners of PG, UG, students of GHMC and other institutions for taking active participation in this webinar series. Once again, thanking you one and all. I request you to give the feedback of this program given at our college website, GHMC Bangalore. Special thanks to Dr. Bharat, working day in, day out to make this webinar series a successful. I thank webinar team of PG scholars who worked as a teamwork and who worked with Dr. Bharat and made this program successful. Last but least, I extend my sincere thanks to all the participants for joining us all the 15 days of webinar series actively and making this webinar series a grand success. I thank each and every one of you who supported directly and indirectly for this webinar. Goodbye to everybody.
We request the participants to wait for some time so that we'll post in the feedback forms on the chat box. I request all the participants to kindly wait.
Thank you, ma'am. I thank webinar team, Dr. Jivesh, Dr. Siddhamma, Dr. Mohammad Sali, Dr. Rohit, Dr. Al Sabha, Dr. Swasti, Dr. Sushmita, Dr. Hiranmayi, Dr. Krishnadas, Dr. Vaishnavi, Dr. Swati, Dr. Manish, Dr. Nanda, Dr. Nishkala, Dr. Shrija, Dr. Suvarna, without whom this series would have been impossible. And special thanks to Dr. Bharat for coordinating for all these 15 days and making this series a successful. I also thank all the participants for joining us all 15 days of this webinar series actively and making this webinar series a grand success. We would like to have a genuine feedback from all the participants. We will be sharing a feedback form on webinar groups. So I sincerely request you all to share your feedback. Now I request Dr. Bharat to conclude the session. Over to you, Dr. Bharat.
Thank you, Dr. Rohan. Yes, it has been a quite long sessions we have been running out. Today we come to the end of the 15th day of the webinar series. It took a lot of time for us to bring in the speakers, various right from beginning from rare remedies to thyroid complaints, to diet, to acute disease conditions, treating COVID, various from finally we concluding with the professionalism. And I think this topic, concluding with this topic would definitely help the practitioners too, as well as the other topics which we chose definitely would have helped the upcoming homeopaths, as well as our students who have been participating all these long days. Thank you for all the support. I wholeheartedly thank the webinar committee. I mean the PG committee, coordination committee, especially our principal, Dr. V. Guruprasad sir, for giving us the permission and encouraging us to conduct this. And a special thanks to Dr. Rajeshwari ma'am and Dr. Renuka ma'am and Dr. Anusuya ma'am for coordinating with us and helping us. And a big thanks to the technical team, without which I couldn't have taken up this initiative in conducting these webinars. And definitely we request the participants to kindly fill in the Google form, which we have already put it on the chat box, and we'll be sharing it on the webinar broadcast groups though. And kindly give in your suggestions. We would like to hear the genuine suggestions, any improvements to be done, any, further sessions, how to be conducted, any speaker suggestion or any topic suggestions, how should we conduct in further. And thank you everyone for joining us. It's been a long time. Thank you all. Stay home and stay safe. We will one more point regarding the recordings. It will be available very soon, because we have some technical issues going on. We need to check up the records, because once people log in, no, the recording has been done for more than hours together, so it's taking some time for us to get back the recording and downloading it and uploading it on the YouTube channel. So we will definitely upload all these sessions except for one session which we have not yet got. Other 14 sessions already we have uploaded, six sessions already it's been done. So remaining around 9 sessions we'll be uploading it very soon. Thank you all. Thank you for your patience listening. We request all the participants to kindly and duly fill in the feedback forms and get back to us. Thank you all. Thanks for the great support. Signing off from GHMC Bengaluru. Thank you.